In just 11 minutes, uncover 10 powerful takeaways from Dr. Mike's explosive talk with renowned plastic surgeon Elisabeth Potter on mid-surgery insurance denials, corporate healthcare greed, banned breast reconstruction, broken doctors, and how one woman took on the entire system. Takeaway 1. She was interrupted mid-surgery by an insurer. Dr. Elisabeth Potter shared a shocking moment that lit up the internet. While she was deep in surgery, literally reconstructing a woman's breast after cancer, her phone started ringing. It was United Healthcare, one of the largest insurance companies in the country. They weren't calling to check in or help. They were calling to say no. They wanted to deny a treatment she was performing right that moment. Dr. Potter couldn't believe it. She was in the operating room caring for a woman who had already been through the trauma of cancer, and the insurance company thought it was acceptable to call mid-procedure and refuse to pay. She posted about the experience on Instagram. She didn't expect much. But the post went viral, spreading across the country like wildfire. It wasn't just doctors who were outraged. Regular people could feel how wrong this was. Millions of people shared it, commented on it, and reached out. Journalists called her. Strangers thanked her. Her story cracked open a much bigger conversation about how deep insurance interference has become in healthcare. For example, just one day after the post exploded, a surgeon she didn't even know walked up to her and quietly said, "Thank you for saying that." That's when she realized how widespread the frustration had become, and how rare it is for someone to actually speak out. Now let's move to the next takeaway. Takeaway 2. One woman took on the entire system. After that viral moment, Dr. Potter didn't stop. She went straight into action, not just talking online, but also taking real steps in Washington, D.C. When the American Society of Plastic Surgeons failed to stand up for a critical surgery code that helped women access better breast reconstruction, Dr. Potter went to war. She hired her own lobbyists. She started working with patient advocacy groups. She even helped a group of lawmakers draft a bill to protect access to this type of surgery. It wasn't easy. At one point, officials from the society came to her home with a bottle of champagne. But it wasn't a celebration. They tried to convince her to stop speaking up. Standing in her kitchen with a leaky roof and a tired heart, she told them, "Come at me." She wasn't scared of them. She was scared of doing nothing. For example, she didn't just lobby for a new rule. She got the White House involved and helped change Medicare policies so that women all over the country could still receive the surgery they deserved. Now let's move to the next takeaway. Takeaway 3. How insurance is quietly killing healthcare. Behind all these dramatic moments is a slow, quiet war that most people never see. Insurance companies have learned how to deny care without anyone noticing. They delay approvals, reject claims with vague reasons, and create complex paperwork that overwhelms both doctors and patients. It's a game designed to make people give up. Dr. Potter says the companies count on people quitting because when you quit, they win. She explained how only about 1% of denied patients even try to appeal. That tiny number is exactly what insurers rely on. They deny first, wait, and then quietly walk away with their profits while patients are left untreated and doctors are unpaid. For example, she had a patient who needed both breasts removed due to cancer. The insurance company approved one, then made her wait a full year for the second, even though the surgery should have been done together. There was no medical reason, just bureaucracy. Now let's move to the next takeaway. Takeaway 4. The system profits when you suffer. Dr. Potter makes it clear the system isn't failing. It's working exactly as designed, and that design rewards suffering. Insurance companies and hospitals have figured out how to turn patient pain into profit. They do it by dragging their feet, forcing doctors to waste hours on paperwork, and rejecting even basic treatments. These denials aren't mistakes. They're part of the business model. Dr. Mike added that the system makes it hard even for well-meaning doctors to do their jobs. If you work inside a corporate hospital system, you're expected to see more patients per hour, hit satisfaction scores, and avoid anything that's expensive or complicated. That's not medicine. That's a quota. For example, one insurer denied a simple treatment to a woman recovering from radiation, not because it was unsafe, but because they had an internal rule to wait 6 months. Dr. Potter's research showed it was safer to operate sooner, but that didn't matter. Now let's move to the next takeaway. Takeaway 5. Secret rules keep doctors underpaid. There's another side to this crisis. Doctors are being cheated too. Dr. Potter found out she was being paid 30% less than her peers for the exact same surgery, even though she had better results and more experience. When she asked why, no one could answer. That's because prices are decided in secret meetings, using billing codes that no patient or public agency controls. She explained how the government once paid surgeons over $20,000 to do a certain advanced breast reconstruction. Then, without warning, the code was changed. Now it pays less than $3,000. Same surgery, same skill, but almost no money. For example, she found out that a doctor in her city was being paid far more for an outdated method that caused more damage to the patient, just because that code hadn't been changed yet. We're halfway through the video. Thanks for sticking with us. If you're enjoying it, hit the thumbs up and share it in your WhatsApp groups. If you'd like to support us, please tap the thanks button below. It helps us keep making great content. Drop a comment and don't forget to hit subscribe for more. Now let's continue with the video. Takeaway 6. Breast reconstruction is under attack. Dr. Potter is one of the few surgeons left in America who performs a breast reconstruction using a woman's own tissue, known as the DEP flap. This method lets women feel whole again after cancer without using implants. It also reduces long-term pain and looks more natural. But this surgery takes more skill, more time, and more commitment. Insurance companies don't like that. They tried to erase the billing code that made this surgery possible. If Dr. Potter hadn't fought back, it would have disappeared quietly, and thousands of women would have lost their best option. She says it felt like they were trying to erase her work and the women she served from the system entirely. For example, women who wanted to return to physical activity or sports after cancer had a much better chance of doing that with this type of reconstruction. But insurers were pushing the cheaper method that removed abdominal muscles and caused long-term weakness. Now let's move to the next takeaway. Takeaway 7. Big companies control your treatment options. The problem isn't just insurance, it's consolidation. Big companies now own everything. Hospitals, clinics, pharmacies, even some doctor groups. When they control every step of your care, they start making decisions that aren't based on medicine but on profit margins. Dr. Mike explained how doctors in these systems are pressured to follow corporate protocols instead of medical judgment. If you push back, you're replaced. Dr. Potter warned that this trend means patients are no longer being treated like humans. They're treated like cost centers. For example, peer reviewers at insurance companies are often told to reject cases quickly without even reading the full records. It's not about safety. It's about savings. Now let's move to the next takeaway. Takeaway 8. Fighting the system nearly broke her. Dr. Potter's fight came with a cost. She drained her savings to keep her independent clinic running. She faced online attacks, personal stress, and public criticism. When her own professional society labeled her disparaging, it felt like betrayal. But she kept going. She said it wasn't easy waking up every day not knowing if her clinic could stay open. But she stayed focused on the women she was helping, women who needed her to keep going when everyone else quit. For example, she told her family she wouldn't leave them money. She would leave them something more important, a legacy that changed how breast cancer survivors are treated. Now let's move to the next takeaway. Takeaway 9. Doctors are burning out and quitting. Dr. Mike and Dr. Potter both admitted that many of their colleagues are walking away from medicine, not because they don't care, but because the system is grinding them down. Endless denials, ridiculous forms, and being forced to fight for every basic treatment is pushing doctors out. They talked about how the joy of medicine is being replaced by the stress of coding and paperwork. Even simple tasks like writing a prescription now come with error messages, rejections, and follow-up calls that suck time and energy. For example, a psychiatrist trying to treat patients with low income was forced to raise rates or stop seeing them altogether, just because the insurer refused to cover mental health properly. Now let's move to the last takeaway. Takeaway 10. Purpose helps fight fear and pressure. Despite all this, Dr. Potter remains hopeful. She said her mission gives her the strength to keep going, even on the hardest days. She's learned to cheer for herself, take up space, and trust that discomfort is often a sign she's growing. She admits she's scared sometimes, but she won't let fear run her life. She encourages others to find their purpose and hold on to it like a compass. When you're doing something meaningful, even the worst days can feel worth it. For example, some days she reads comments online from strangers just to remind herself that what she's doing matters, even if the system fights her every step of the way. Here is a brief introduction about Dr. Elisabeth Potter. Dr. Elisabeth Potter is a board-certified plastic surgeon specializing in advanced breast reconstruction for women recovering from breast cancer. She is widely recognized for her patient advocacy and for challenging insurance companies to protect access to high-quality surgical care. Thank you for watching. If you'd like to support this channel, hit the thanks button below. It really helps us keep going. If you enjoyed this summary, please leave a like and share it in your WhatsApp groups. To join discussion about this video, drop a comment below. And for more videos like this, hit the subscribe button below.